Thanks for tuning in to Vital Motion Podcast. Let this be a place to grow your mindset and prioritize movement. All audio is original with music and production support from Riverside as my editing platform. This podcast is for education and inspiration only, and any studies or products I mention are simply for context. Take what fits into your life and check in with your healthcare medical providers as you feel is necessary. Thank you so much, and I'd love for you to like and subscribe to my channel. Happy listening.
Welcome back, everyone. This week's episode is going to be kind of short and sweet, especially since it's just a solo episode. And we're going to be actually talking about pain again, because I feel like this is such an important topic for us to understand, but for you to be aware of, and so you can kind of get the best help that you need. So this week specifically, we're going to talk about what is known as referral pain patterns, and we're going to kind of dive into the different kinds. And so in the physical therapy world, we're really good at diagnosing musculoskeletal dysfunction. However, we are also taught to recognize the red flags that may not be related to that. And so, what I mean by musculoskeletal dysfunction is anything related to your muscle, your bones, your tendons, and your ligaments. In an exam, most of the time we're able to replicate those symptoms. So, we can have a better idea of how to guide your treatment based off of the symptoms that reproduce your pain. And so the typical kinds of pain that we see related to the referral pains is going to be either some kind of nerve pain or muscle related referral pain. And so for the nerve pain, that's when you have that numbness, tingling, burning going down your leg or your arm. And most of the time it's coming from your spinal cord or somewhere in your back. And so that would be something that we could definitely treat in the clinic and hopefully get you feeling better. Sometimes when it's in the later phases of that burning, numbness, and tingling that's been going on for a long time, it's harder to centralize those symptoms. So the quicker you can get in the clinic when you start to feel those symptoms, the better off you're going to be in the long run. And then the next kind of radiating pain that we typically see in the clinic is going to be any muscle related referral pain. So, for example, if you're having pain on the outside of your shoulder and your deltoid, it could be coming from a rotator cuff dysfunction or weakness. And so, again, we would find something that would replicate your pain and we would treat you based off of the symptoms that we found in the examination. Just to kind of give you a couple other examples of this, sometimes people have a lot of headaches. Well, there's different kinds, but specifically this kind, a tension related headache, could be coming from weakness in your posture muscles or fatigue, especially if you have a desk job and you're leaned over your computer all day. That can be an issue, but it's treatable because it's actually just going to be coming from a lot of strength and stability of those posture muscles to help you be more aware so you aren't getting those tension headaches as much. Another example that we see a lot in the clinic is knee pain, especially on the inside of your knee. And most of the time, it could be coming from multiple different things. It could be coming from a little bit of joint degeneration or arthritis, or it could be coming from weakness in your glute med, which is a muscle on the side of your leg, and it helps to stabilize us, especially when we're walking. And so, if that muscle is weak, the leg's going to be kind of turned more inward, putting more pressure on that inside of that knee. Same with the foot. If you're wearing a narrow shoe, those toes are all squished together in there, and the foot is going to kind of sit more inward. And again, that's just going to put more pressure on the inside of your knee. So, any little thing I can do to mention the importance of a wide toe box shoe, I'm going to throw in there. As you all know, I'm a huge advocate for that. So, that's just one of the many reasons why, and I think everyone should be wearing them. Anyways, so yeah, if it's related to that nerve dysfunction or muscle dysfunction, those are things that we can help treat in the clinic, get you feeling better, get you moving better. And it's one of those things where if you feel like you're constantly stretching and nothing is changing, well, why is that? Most of the time, it's going to be from compensated muscles that are overworking. And when we strengthen and stabilize the muscles that are weaker, you may find that you aren't as tight or you don't have to stretch those muscles as much. There's a time and place for stretching, and stretching is sometimes kind of a band-aid fix because it's such a temporary feeling of relief, if I guess that's what I want to call it. So, like I said, if stretching is not helping, then we need to move to the next step or the next level. And that's where PT can be great to kind of guide you in what that looks like. And then the last kind of referral pain is that red flag referral pain that I was talking about earlier. And this is the kind of pain that we want to be aware of. I want you to be aware of. And so if something just doesn't feel right and you're feeling it in your gut that something isn't right, then we can help you act on it. Typically, this type of referral pain is going to be coming from one of your organs. For example, a lot of the times people who have like left arm pain, especially if they're getting like tightness in their chest with exertion, like running or anything that gets their heart rate up, it could be related to something going on in their heart. And so we would want to refer them to a cardiologist, or like I said, if you know someone that's having those issues, maybe suggest them to go get their heart checked out. It doesn't hurt to be on the safe side rather than wait for like a heart attack or something to happen and then you have to treat something that maybe could have been prevented. So I think it's so important for us to recognize these red flags and these symptoms. And a lot of that is on the medical healthcare providers, but as a society, I think we should also be aware of these. And so if we do see someone experiencing that or we're experiencing it ourselves, we can understand it to get the help that we do need. And some other red flags that we may look out for is if you've recently had a lot of weight loss without using any supplements or medications, or you're not going to the gym, the weight has just kind of been falling off and you're not sure why. Another one could be if you have like a palpable mass, especially on your breast, swelling that won't go away, a rash or change in your skin, change in your nail beds, all things that I think we should constantly be checking and looking at on our bodies and be aware of what our quote unquote normal is. And so when we feel something that isn't normal or doesn't look right, a red flag should go off in our head that, okay, we probably need to go seek, help or get some kind of imaging done, whatever the case may be. Another common one is if you have night pain, persistent night pain that just won't go away no matter what position you're in bed, it just constantly is nagging you. Now, I will say there are musculoskeletal related night pain that can happen. For example, if you're laying on your shoulder and it's just like every time you're laying on it, it bothers you. That's a typical like musculoskeletal night pain, and that's usually not as much of a concern. But if it's constantly nagging you, like I said, especially like your more so your upper back, then that might be a sign that something else is going on. And so this is not meant to scare you because most of the time people are having that nerve or muscle pain. It's mostly just to educate you and make you more aware of that there is different types of referral pain, and sometimes understanding it can make it less scary and less intimidating. And it may be one of those things where you start at physical therapy and they can determine whether or not you're a good fit for therapy or if you need to be referred out to someone else. And it's not understood or quite understood why these pain referral patterns happen. I think it's just the way that our nervous system is wired. And so there is common referral sites for these organs that we look out for, especially if maybe you're having like a dull ache in your mid back. It could be, something going on with your kidneys. So, yeah, as I always say, this podcast is just to kind of help give you more information and guidance and tools to utilize. And so, if you are experiencing any of these weird or crazy symptoms, trust your gut, get the help that you need. I think understanding these kinds of things can be so useful, especially because a lot of stuff unfortunately goes misdiagnosed or gets missed. And so if you have somewhat of a background in it, it makes it less scary, less intimidating to get the help that you need. We have to be advocates for ourselves and our health because we're the only ones that can truly understand or feel what we're going through. And so don't be afraid to get the help that you need, especially if something doesn't feel right. And if you are having that nerve pain or that muscle pain, here's your sign to also go get the help that you need from a physical therapist. And I hope you all enjoy the rest of your day. And yeah, thanks for tuning in for this short little episode. We will see you next time.